Hello, everyone. So, today we are going to discuss some therapeutic communication skills or strategies that we usually use when we are dealing with psychiatric or mentally ill patients. Some of these patients have hallucinations and delusions, so their thought processes are different from us. So, how you communicate with a person who is not mentally ill should be different from how we communicate with a mentally ill person. So, let's learn some of the do's and don'ts when we are communicating with our mentally ill patient. So, the first thing is never disagree or simply agree with a patient. For instance, a patient comes to tell you that he has been battling with aliens lately, or he's the president of the nation and he has a lot of responsibilities to deal with. So because of that, he's tired. Something like that. Don't say, okay, that's true, or agree with them simply, but do not also tell them that you are not the president or there are no aliens. What you should rather do is to acknowledge and validate this client's feelings. So, what you should do, your right response could be, so for example, you could say, it sounds like you are feeling really overwhelmed by this. This must be tough to go through. You are validating this client's feelings. Secondly, do not ask personal questions when you're interacting or communicating with clients, and don't use the word why. Never ask why when you are communicating with the clients. You should rather use open ended questions to encourage more communication from your clients. Never use why, why, in communicating with your clients, and avoid stereotype. Do not give stereotypical answers to your client. Do not also challenge your patients. Do not challenge them. What you can do is to reorient them. Mr. Jackson, you are in the hospital right now, and just reorient them. Let them know where they are right now in the situation, what you are doing with them right now. Sometimes they are out of it. They don't even realize that they are in the hospital setting or they are receiving treatment. They are in their own world. So don't challenge them. Challenging them may only add to their anxiety level. So what you can do is to reorient your clients. And you should not also change the subject immediately like that. Don't just abruptly change the subject. You should do your reorientation gradually. Don't change the subject totally like that when your client is trying to open up to you. Even if you know the client is hallucinating or being delusional, but you shouldn't change the subject just like that. And do not be defensive. Do not be defensive in your communication with your client. You should rather focus on your client's feelings. Do not be what defensive in your communication with your client. You should focus on client's feeling. Let me give you an example of that. So, for instance, the client said, I feel you don't listen to me. Anytime I'm talking to you, you don't give me attention. Don't go like, I'm listening to you. I'm always giving, you are being defensive. No. You should rather focus on your client's feeling. I'm sorry you feel that way. I want you to be heard. Let's focus on what's most important to you right now. Or let's discuss your feelings or your needs right now. Acknowledge your client's feelings. So let's stop here and then we'll continue next time.